the next 35 years, the child population in Africa will grow by more than 67%. As the child population in Africa grows, so investment in these children becomes important for the future development of the continent. Are African governments committed to invest in children? In our program today, we'll look at national government's budgetary allocation to children in Africa and specifically in Kenya. My name is Winnie Onyimbo, reporting for Transworld Radio Kenya. Investment in children by African governments is needed. Investment in human capital and in essential goods and services that are sustainable, of good quality, and accessible to all children. This includes investment in sectors of protection, nutrition, health, and education. A number of important international agreements have been signed by African countries to highlight the importance of investing in children. The notable ones include the Abuja Declaration of 2001, where countries pledged to give 15% of their national budget to improve the health sector in their countries, and the Education for All Agreement in 2010, where countries promised to allocate at least 20% of the national budget for education. The greatest beneficiaries for these agreements would be children. In Kenya, special budgetary allocations are made for special groups like women, the youth, or the disabled. But does the Kenyan budget have allocations specifically set aside for children? I had a one-on-one interview with Ibrahim Alubala, Head of Advocacy and Campaigns at Save the Children Kenya Country Office.
One of the major challenges we have with the way the budget in Kenya is crafted is that we don't have distinct lines for children. And the challenge here is that children are largely seen as a service sector. They are not looked at as a separate cohort in the Kenyan population, like you would say women. Another distinct cohort would probably be the youth. But children, we still haven't succeeded in the sense of advocating for them to be looked at as a distinct cohort.
So then when the budget is read and there are lump sums allocated to different ministries, how then does it trickle down to children?
There is an assumption that when you allocate money, say, to the free primary education program, children will benefit. And I've said an assumption because of late we've seen right from when we had the free primary education starting in 2003, you saw a lot of elderly people, trooping back to school. The late Kimani Maruge is a classical example, and many others have followed suit. So it does not necessarily mean that the money is allocated for pre-primary education, for example, would benefit children alone. There would be other people, benefiting, but by and large, children will benefit. Education gets a lion's share in the national budget, but a huge chunk of it goes to tertiary education, which doesn't touch on children. If you look at, say, health, again, like you rightly pointed out, there would be, say, a blanket allocation to fund health programs. And the assumption, again, is children will largely benefit from these health programs. And also supporting other recurrent costs, like payment of salaries and so forth and so on. These, again, would be viewed as money is going to children, but largely, again, these monies will go towards supporting salaries and other, infrastructural programs or projects.
The last 3 annual budgetary policy statements in Kenya have included 47 county governments, which were established under the 2010 Kenyan Constitution. Resources, power, and functions were devolved to county governments, which started work in 2013 in an attempt to ensure equitable development. One of the biggest gains for children has been revamping of early childhood development centers by handing its management over to county governments. This has improved the Kenyan education system and standards by putting emphasis on foundations a child gets in education, which tends to affect how such a child engages with education in later life. Devolution has also increased the number of children who get exposed to education, which has directly affected the number of children who stay in school through primary, secondary, and university level. Kenya has made significant strides, especially in the area of early childhood education, but we can still do better, as Alubala says.
There are a couple of functions that touch directly on children, and I'll mention maybe 3 or 4. The first function relates to health. We've seen a lot of counties making direct allocations to health. In fact, if you pick out any county budget, it's highly likely that money is going towards health, take the lion's share in terms of budgetary allocations. The other trend that we realized in terms of budgetary allocations is that they have been increasing over time. So in all the counties that we focused on, we noted a very small increment, which is a very good thing, because the right to health falls within the category of rights that we call socioeconomic rights. If you look at the drafting of Article 43 of the Constitution, it requires that socioeconomic rights, including the right to health, the right to education, are supposed to be progressively realized. That means that every year you must, demonstrate that you are progressively increasing resources to address some of those rights. We've seen county governments investing a lot in terms of setting up facilities, and by and large, children would benefit from these facilities. The other function that relates to children is the function of pre-primary education, which we popularly refer to as ECD, early childhood development. I think we've also witnessed remarkable progress here, because many older Kenyans would confess that in earlier years before devolution, the so-called nursery schools or ECD facilities were not, very seriously taken. The government did not seriously take pre-primary education. Now that it's a county function, we've seen many counties again increasing resources to address issues of early childhood development. We have seen county governments employing, teachers whom they are calling ECD assistants because of the technicality with the Teacher Service Commission Act. And so that is a very good thing, because we're seeing a lot of investment happening in that sector. The third area under the fourth schedule is an area that county governments have not done very well generally, and this is the area of childcare facilities. It is expected under the fourth schedule that county governments are supposed to come up with childcare facilities for children, but very few county governments are actually investing in that area. It's an advocacy area for us to just encourage county governments to put in more resources on childcare facilities. Many county governments have interpreted childcare facilities to mean children homes. So you go to a county and if you interrogate the county budget, you will see that they probably allocate 1 million or 2 million shillings to a children's home, and nobody follows up to see how that money is spent.
When national budgetary allocation money is not allocated or spent appropriately, effective service delivery is delayed or denied, and funds may be spent on the wrong things, or they may reach service delivery facilities too late. This can cause irreparable damage. For example, a sick child may go to a clinic that lacks medicines or that has closed due to lack of funding. That child may die or may be impaired for life. Alubala encourages national and county governments to conduct a budget analysis after budgetary allocations.
In terms of ensuring that counties actually allocate more funds that would benefit children, we're encouraging counties to conduct what we call budget analysis, just to ask themselves if it's true that children constitute more than 50% of the entire population, how much is actually going to children. And like we said at the very onset, it would be very minimal. Research was done, I think, 2-3 years ago by the Institute of Economic Affairs, and it was found that less than 15% of the budget actually goes directly to benefit children. So ours is to push for a case for more budgetary allocations for children, because there is a lot of research that shows that if you invest in children, you reap significant returns. There's a research that was done by World Bank a couple of years ago, which showed that if you invest $1 in nutrition programs, you are bound to have a return of more than $3 cumulatively. So money is being invested in some of these quote-unquote soft investments. Is not money that is getting lost. If you put money, any parent would tell you that if you invest money in a child's education, you're actually building the life of that particular child. So county governments should not shy away from putting investment in children. Our encouragement is they should do budget analysis, ask themselves how much money they are putting in children, and if the answer is they're not putting in enough resources, then perhaps the narrative needs to be revised so that we have more monies being invested towards children programs. Because like I said, this is not money that is getting lost, but we shall see the benefits of these monies in the fullness of time.
How about the national government when it's allocating? What would you advise so that they are able to allocate funds to specifically for children?
Again, it's the same thing with the national government, doing an analysis just to find out. You know that African governments have made a commitment. They made a commitment in the year 2001 that they would allocate 15% of national budgets towards health programs. Now, before devolution, it was found that Kenya was doing very badly in that regard because our allocations were oscillating between 7 to 8%. Which is more than slightly less than half of the expectation. And so there is need for the national government to ask itself cumulatively in terms of if we are running a budget of about 2 trillion Kenya shillings, how much money is actually going to health programs. And that should, in the spirit of the Abuja Declaration of 2001, be more than 15%. We still haven't done a research on that, but from my own assessment, I think we're still faring badly in terms of the realizing the 15% Abuja Declaration, which I think needs to be done.
Over the next 40 years, the number of children aged below 18 in Africa will increase by over 60% to almost 1 billion. As the child population in Africa grows, so investment in those children will become key for their survival and development, for the future social-economic development of the region, and for its political stability. Africa can turn this large population change to its advantage by investing in its children and by making sure that this is done in an equitable way.